Welcome to www.unitedmedical.sg. Catering to women of all ages as a specialist clinic, United Medical specializes in gynecology treatment and advanced keyhole laparoscopic surgery. As no patients are the same, the combination of these subspecialties allows us to personalize therapy for each patient. Additionally, United Medical expressed a keen interest in cervical cancer screening, colposcopy, and treatment of pre-invasive cervical disease, gynaecologist, endometriosis, uterine fibroids, fallopian tubes, ovarian cysts, polycystic ovary syndrome, cervical cancer, cervical erosion, vaginal infections and discharge, urinary incontinence, menstruation disorders, vaginal bleeding during non-menstrual period, dysmenorrhea, women's vaccine and prevention, cervical smear tests, colposcopy, laparoscopic surgery. Reasons to choose United Medical. United Medical specializes in obstetrics and gynecology services. Our specialist has admission rights to Singapore's 7 hospitals. Hence, when the need arises, patients can choose to be admitted to their preferred hospital. Comprehensive suite of obstetrics and gynecology services. We provide a comprehensive general obstetrics and gynecology practice. Dr. Stephen Teo's and Dr. Liana Ko's passion lies in fertility treatment and advanced keyhole laparoscopic surgery. As no two patients are the same, the combination of these subspecialties allows Dr. Stephen Teo and Dr. Liana Ko to individualize therapy for each patient. Health screening packages. Health screening package. Please check with clinic on prevailing package fees. For ladies in the reproductive age group 18-40 years, basic package includes fasting cholesterol, lipid levels, glucose, full blood count, renal panel including urine test, cervical smear, pelvic ultrasound scan, ECG, chest X-ray and thorough physical examination. Additional tests may be customized depending on outcome of medical interview and examination. Health screening package B. Please check with clinic on prevailing package fees. For ladies 40 years and above, basic package includes tests listed in package A, and in addition, mammography, stool occult blood and bone density scan for menopausal women only. Additional tests may be customized depending on outcome of medical interview and examination. For more information, please click United Medical Packages. We empower our patients. By providing comprehensive information and education throughout the process, you will be better equipped to understand the various treatment options, thereby putting your mind at ease. 5. Patient support and personalized care. We work closely with patients to offer personalized treatment. From the beginning of the journey, we will map out together with you a unique treatment plan to fit your schedule and address any medical and emotional challenges along the way. 6. Flexibility. As each patient is unique, we are able to tailor treatments to suit your very own needs and requirements, something that is particularly important for patients from overseas. 7. Team excellence. Our nurses and administrative staff possess a wealth of experience. We take pride in offering the latest knowledge in the field of fertility. For enquiries or appointment bookings, please do not hesitate to contact our staff. Dr. Stephen Teo, obstetrician and gynecologist. Dr. Stephen Teo graduated from National University of Singapore and went on to train in obstetrics and gynecology with the Royal College of Obstetrics and Gynaecology, United Kingdom. He attained the specialist degree of Master of Medicine ONG from Singapore and became a member of the Royal College of Obstetrics and Gynaecology, United Kingdom. Besides general obstetrics and gynecology practice, Dr. Teo's passion lies in fertility treatment and advanced keyhole laparoscopic surgery. As no two patients are the same, the combination of these subspecialties allows Dr. Stephen Teo to individualize therapy for each patient. As a specialist in KK Women's and Children's Hospital, Dr. Teo had previously received various awards for exemplary performance in public service. Trained at KKIVF Center, he obtained Ministry of Health MOH accreditation to practice the full spectrum of assisted reproduction techniques ART, including IVF, ICSI and surgical sperm retrieval. Under the Mohsin Gilth HMDP program, he trained in Sydney, Australia with renowned laparoscopic surgeons to be proficient in the removal of endometriosis and advanced keyhole surgery. As a fertility specialist, Dr. Stephen Teo has helped many couples realize their dreams of parenthood. As an obstetrician, he has looked after many pregnancies and delivered precious bundles of joy. As a gynaecologist, women of all ages have benefited from receiving surgery and medical treatment under him. As a doctor, his vision is to provide care and comfort to all patients. Dr. Stephen Teo has admission rights to Singapore's 7 hospitals. Hence, when the need arises, patients can choose to be admitted to their preferred hospital. United Medical specializes a complete women's healthcare service. Understanding and compassion, matched with highly developed skills and knowledge, makes us a truly distinguished practice. We specializes in fertility treatment and advanced keyhole laparoscopic surgery. We expressed a keen interest in cervical cancer screening, colposcopy, and treatment of pre-invasive cervical disease. The combination of these subspecialties allows us to personalize therapy for each patient. Fibroid symptoms. The majority of fibroids are small and do not cause any symptoms at all. But many women have significant problems that interfere with some aspect of their lives and want to be treated. The symptoms are related to the number, size, and location of the fibroids, and fall into 4 main groups. Increased uterine bleeding. Fibroids may cause the menstrual bleeding to be heavier, or increase in the duration of bleeding, or may cause bleeding in between periods. Some women may have a combination of bleeding symptoms. The presence and degree of uterine bleeding is determined mainly by the location of the fibroid. Women with fibroids that protrude into the uterus are more likely to have significant increases in bleeding. Pelvic pressure and pain. Fibroids can range in size from microscopic to the size of a basketball or even larger. Larger fibroids may cause a sense of pressure and fullness in the abdomen, similar to that caused by pregnancy. Fibroids of variable sizes can cause other symptoms depending on where they are located. For example, if the fibroid is pressing on the bladder, frequent urination can occur. A fibroid that pushes on the rectum can cause constipation, and one that puts pressure on the cervix can result in painful intercourse. Infertility and miscarriage. Fibroids may cause infertility in a number of different ways. A fibroid may cause compression on the fallopian tubes, resulting in a blockage of the passage of sperm or eggs. A large fibroid may distort the pelvic anatomy sufficiently to make it difficult for the fallopian tube to capture an egg at the time of ovulation. If a fibroid protrudes into the uterine cavity or causes distortion of the uterine cavity, it may present a mechanical barrier to implantation. Some studies have suggested that fibroids in the muscle portion of the uterus may cause an alteration or reduction of blood flow to the uterine lining, making it more difficult for an implanted embryo to grow and develop. Another theory suggests that even small fibroids that grow inside of the uterine cavity may act as a foreign body and result in an inflammatory reaction that makes the uterine environment hostile for an embryo to implant. Some of these same possibilities may also increase the risk of an embryo to miscarry. Another possible cause for miscarriage is running out of space as the fetus grows. Pregnancy complications. Some studies have suggested a slightly increased risk of certain problems during pregnancy in women with very large fibroids, including difficulties with labor, breech presentation of the fetus, premature rupture of the bag of waters, and abruptioplacenta, a condition in which the placenta separates from the uterine wall during the pregnancy. These problems are more likely if the placenta is implanted over the area of the large fibroid. However, many women with fibroids have completely normal pregnancies and deliver healthy babies with no complications. Please visit our site www.unitedmedical.sg for more information on Singapore Obstetrics and Gynaecology.